Okay, so this is our first introduction to movement for Danny. The first time he's used this tool, and so he is unfamiliar with the motion that it's going to support. So what we're going to teach him is that, Danny, you want to use your non-involved arm, your left arm, to do all the work. The right arm will stay completely relaxed, and that's kind of hard to do. So you want to just practice at letting the tool hold the weight of your arm. And I'm going to come with you, and let's just do it together. Just short arc motions to begin with. Our goal is for the humeral head in the socket to move freely, and I'll show that in a moment with the model. But that's the goal. The tendency is for the scapula and the arm to stay together like a bundled movement. That's the protection we're inherently going to try to stabilize with. But to alleviate pain, and with the alleviation of pain we get circulation, and the circulation is what actually supports the healing, to take away inflammation and swelling, and the oxygenated blood will actually replenish the muscle tissue to support the healing after surgery, and including with chronic pain. So Danny, you're doing really good. So just keep that going with your left arm doing the work. I'm going to let go, and you do all the work with the left arm. Continue to let the tool hold the weight of your arm. And so with the shoulder blade, that's what we want to have stable. And the humeral head is just purely moving without the scapula moving. So the hiking of the shoulder or the bundled movement is more like that, but we want to have just a free spinning motion. It's very relaxed. And if you're in pain and you can produce that, you'll recognize your arm to begin to relax. And then your nervous system learns that. And that's the most important part of the initiation of the motion, that it's not bound up and protective, because once motion starts, thereafter it will stay protected. We have to have a therapeutic influence from the very beginning of the movement. And then what we can do once he's gained confidence with that is we can move the non-involved arm to the back, and then he can just make it more natural, almost like he's going to reach out and grab something, which is, again, thinking of the visualization of motion, making it real. Your nervous system, despite it not working at the shoulder, has preparatory support of movement. So through your passive recovery of movement, if you can think of reaching, you preserve some of that organization, that when you get to actual movement of the arm again, then you will have that foundation preserved. And this is just more natural. So this process is designed to go at home with people, with patients, so that they can not have to be at home in pain and not moving. It's a continuation of the care you can get in your therapy clinics. And another side benefit of this is because it's relaxing. It's a great method of relaxing a patient before your manual work. So as a patient comes into the clinic, having them do this prior to getting on the table, which is what we're going to show next. And so we do the passive range of motion on the table, and then putting the patient back into the support, and then that motion that you gain can be integrated or made sense of with the body as you progressively get further and further with motions of elevation. And then another way of making it more natural is to reach in different directions. And just think of different apparatuses at home that you're reaching across the counter, and just make it as real as possible. And then just reminding yourself to keep your neck relaxed, keep connected with your breathing, and just avoid those tendencies, especially when you get fatigued, to start tensing. Okay?